Buki Ademola here with you again, a registered nurse by profession. Today, I'm going to be discussing on asthma role play guide. Asthma role play guide. But before we go ahead, just few tips for your OET success. Number one, what is that motivational factor that brought you on this journey? Be focused. Don't lose your focus, and let that motivational force give you the drive to move in the right direction, applying the right strategy. This will help you to go a long way to achieve your success. The second tip, and this is one of my secrets to achieve success in my OET, listen to health podcasts on history taking. Fine, OET is not a test of your medical knowledge, but series of health podcasts will give you language to play with in terms of it as it relates to your role play. So listen to health podcasts, series of health podcasts on history taking will go a long way to help you. It's still the same structure when it comes to the clinical assessment criteria. That's the two tips I have for today. Now to the main focus, which is role play guide on asthma. The question: a 3-year-old child was brought to the emergency department by the parents with cough, chest tightness, wheezy, and dyspnea. The parents are agitated and anxious. They want the doctor to attend to the child fast. You are the nurse taking the child vital signs. My task. Now the task I'm expected to play. I need to explain to the parents that the emergency department is busy at this time. As soon as possible, the doctor will attend to the child. I need to ask briefly about the child's condition. Another role I'm expected to play is to explain the care plan process as regards the treatment of this child. I need to make the parent understand that I will be with the child, taking the vitals from time to time until the doctor will be available to attend to the child. And lastly, I need to give a general advice on the care of the child. Now, let's start the role play guide. As the nurse, I will start my introduction in this way. Hello, I'm Buki Ademola, one of the attending nurses in the pediatric emergency department. Can I confirm your child's detail, please, by telling me his name and his age? Now, response expected from my patient. Oh, his name is John. I'm the mom. He's 3 years old. Please, can you do something fast? I've been waiting here for more than half an hour and no doctor have attended to my child. What is this? I'm going to report this situation. This is unbearable. Now, my response as a nurse. Oh, madam, is it okay to call you John's mom? It's okay. It's okay. You can call me John's mom. Okay, thank you, John's mom. It is understandable for you to feel worried and anxious with the condition of your child. But I would like to make you understand that you've come at a very busy time the doctors are attending to critical cases that are life-threatening, more severe than John's condition. That is why no doctor have been able to attend to John. But that doesn't mean John's condition is not a priority to the doctors or to us. But please, Madam, John's mom, just please try to bear with us. In few moments, as soon as possible, the doctor will be here to attend to John. Meanwhile, I will be with John to assess him from time to time and to be sure nothing goes wrong with him. Is that okay with you, John's mom? It's okay. Please just do something fast. Hurry up and do something. Okay, thank you for your understanding. Hello, John. How are you? No, I should be able to relate with both the mom and the son. I would like to just listen to your chest and see how you're breathing. Is that okay, John? Oh, of course, maybe the child may not be able to respond at that time, but the response from the mom, it's okay. You can check him. That's fine. Okay, thank you. So I'm going to listen to John's heart and see how the heart is pumping, and I will keep doing this from time to time. I'll check his temperature to see if he has fever. The temperature is not on the high side, and whatever is necessary, I will do that before your doctor arrives to attend to John. Thank you. Oh, I've listened to John's heart. The heart is breathing quite fast, but not too bad. The oxygen level is 95%, which is acceptable in room air for the condition. But please, I would like you to help to sit John up, let him sit in a comfortable position. I would like to support him with a pillow, and I will keep checking on him from time to time. I will also get back and let the doctor be aware of the situation of John from time to time, and if anything happens, I will definitely escalate the situation, and your doctors will be here to attend to John. Is that fine with you? Or the response I could get from the patient, okay, that's fine, it's okay. Now, the next task. Please, John's mom, I hope it won't sound distressing to ask few questions about how this condition developed or what you noticed before rushing John to the emergency department. It's okay, I'll tell you how it happens. You know, we were out in the park playing, and the weather appears dusty. John started coughing. I noticed he was breathing with some difficulty and some sound coming out with his breath. So I noticed it wasn't himself. So I have to rush him down here to the emergency unit. Oh, thank you so much, John's mom, for letting me know about this. This will go a long way to help in the treatment plan for John. And one more question. Do you, as his mom or dad, anyone in the family, have a history of asthma? Have you heard of asthma before? Do you know what asthma is? Do you have any idea of what asthma is? The response I could get is, I don't have any problem with asthma, but I think his dad had a past history of asthma when he was quite young, but is well controlled, is not taking any drug, not on any medication. So I have a little idea of what asthma is. Oh, great. Thank you, John's mom, for letting me know. Even as I'm talking to you, I'm keeping an eye on John to make sure nothing gets out of hand. Is that fine with you? Oh, it's okay. It's okay. Okay, now I've contacted your doctor, and your doctor have requested to give John a steam nebulization just to calm him down and this will also help him to breathe with ease. For now, he doesn't need oxygen because the saturation level, meaning the oxygen level for John, it's perfect, which is 95%, and even now it's coming up to 96%. So John doesn't really need oxygen for now. I'm only going to give the steam inhalation, and also the next step, I want to take you through the treatment plan so that you have an idea of what your doctor will do for John as soon as he arrives. Your doctor have requested for some blood tests. We call it full blood counts. This will help to know if there's any sign of infection with John. He ordered for an x-ray. We are going to have that also. He's going to have a test called peak flow, but I'm not sure if John will be able to cooperate to do that, but your doctor will decide when he's back on that. Your doctor will give you a treatment guide plan. If John's condition improves, it will be discharged home. It will give you a treatment plan guide that you can follow at home. It has 3 parts, just like the signal. It has green, yellow, and red. The green is acceptable. The yellow is warning and tending towards danger, and the red, of course, it signals danger. So all this plan you follow up at home. You make sure you try to keep him warm, prevent him, control smoke around him, prevent him from getting exposed to smoke, pollens, pets, anything that can irritate him. Don't let him have too much of exercise that can aggravate, him to breathe with difficulty. All this you have to take care even at home. And if at any time there's any signal towards the red flag, you should report to the emergency department immediately. We are going to give you the phone link for your physician and the emergency department in case you need any help. I'm going to give this leaflet also, which will help you. You go through it, and it's going to give a guide on how to take care of asthma patient. I hope you are clear with all we've discussed. I'll just summarize again. Now I can see John is breathing with much ease and is feeling much more comfortable. Did you notice that? Oh, yes. Thank you, nurse. I'm so happy. John is quite better now. Oh, even your doctor is here to see. So I'm going to stop here because your doctor is here. But before I stop, quickly I'll summarize. Please try to keep him warm at home. Prevent him from being exposed to smoke, allergy like pets, pollens. When he's taking part in exercise, be careful that it does not aggravate the breathing difficulty as relates to his condition. Let the teachers, the carers know about his condition. Now I've told you the doctor is going to have a full blood test, x-ray, and will make a decision if John will need a nebulizer or Ventolin inhaler, depending on the conclusion of your doctor assessment. Is that okay with you? Are you happy now? Oh, John, you are so cute. Thank you for your time. Bye for now. Your doctor will take over. That's all I have for you for today. If you find this information useful, please click like. And if you are coming across this for the first time, subscribe. And hope to come your way again. Bye for now.